One of the key tips that I would give for anyone coming for a consultation is to really listen to what the surgeon is saying to you. Often you can get very overcome and quite excited. There can be a wee bit of anxiety about the examination process, and listening to what the surgeon is actually saying to you about what the best options for you are is really, really important. Please bring questions, bring images of your desired outcomes, ideally with someone with a similar shape and size to your body shape as well. I would really recommend bringing a friend or family member as a support system, because that's an extra set of ears, and then you can discuss that when you leave. The other thing that I would definitely recommend, and a lot of people forget to do it, is simply recording the consultation. Our surgeons are more than happy for you to record the consultation on your phone. It means you can listen back to it later. We do also give letters to every single patient after every consult from the surgeon outlining what has been discussed. Research is probably the most common recommendation that we hear people talking about when they're deciding where to have their surgery and what surgeon to choose for their surgery. Obviously online is where most people will go to do their research, and what you need to be very careful of is overly positive reviews. That might sound like quite a strange thing to say, but if you're looking at a provider and everything is 5-star and everyone's absolutely happy, I would ask you to question the realistic nature of those reviews. And I think one of the interesting things about cosmetic surgery and reconstructive surgery is that the provider is very limited in the reply that they can give to that patient, because you're not allowed to breach patient confidentiality. So for instance, if someone leaves a negative review, the provider and the surgeon are very limited in what detail they can go into when they're replying. So what usually happens in those circumstances is they give a standardised reply, and it talks about revision policies and subjectivity, and it's really difficult for a patient to read between the lines. Every provider will have their own terms and conditions, and these are usually provided to you after your consultation with your quotation. It's really important to read these so that you fully understand the agreement that you're signing into with that particular company. What's more important to understand is what is actually covered in the revision policy. Now, for every procedure, that's going to be different. The most common ones that we see are sizing. So if you come for breast implants, you have a consultation, we do our 3D before and after scans. You can also try on sizers, but sizing is a personal preference. There are some limitations with your body anatomy as to what can be placed at a certain amount of time, but having a full understanding of the expectation level at that point is critical for you, because sizing is not covered in a revisional policy for any cosmetic surgery company in the UK as far as I'm aware. The reason for that is because of subjectivity, and the analogy that I use is if you're redecorating your house, for instance. And when you go to the paint department in the various shops, you're having a look and you're trying to decide what's going to work best in your home, in the room that you're looking to make over. So you'll take the samples home and you'll paint them in the wall, and you'll see it in different lighting, and then you'll make your decision, which is the equivalent of trying on the sizers and having your 3D scans. Once you make that decision, you're committing to that, and you then instruct your painter and decorator to paint the walls or the whole room that colour of grey, which he will do and he will charge a fee for. So his time and his expertise is what you're paying for to paint that room. So after your room's been painted, you're going to have your initial reaction, and it's usually, oh wow, I love this, or I'm not so sure if I've made the right choice. But most people will decide to sit with it for a wee while and see how it gels with the rest of the room and with your furniture and everything else once things have settled. If you then decide that you want a different shade of paint on your wall, that is not the painter and decorator's responsibility to rectify that free of charge. That's a decision that you have made, albeit in partnership with the person you've been consulting with, but the decision has been yours based on your personal preferences and the outcome that you're looking to achieve. So if you're then wanting to change that, there will unfortunately be costs associated with that, because there is the anaesthetic fee, the hospital fee, the staffing fee. If you're looking to change implants, there's the cost of the implants, there's the drugs, there's the consumables, there's the aftercare, and there's the insurance. So that is what you're paying for, and it's really important to take your time when you're having your consultations, when you're making your decisions, particularly in relation to sizing, or if you're choosing between having an implant and an uplift and an implant, because that is also not covered in a revision. That is the equivalent of choosing to have an extension built onto your house and then deciding that you want to move where the bathroom is. If you've decided to have implants as opposed to uplift an implant, the revision policy will never cover a subsequent uplift if you're not happy with the positioning. That being said, sometimes things do not go to plan, sometimes there are issues, and that's why there are robust complaints policies in place with all providers. Any provider in Scotland is monitored and regulated by Health Improvement Scotland. We do all have to have complaints processes in place, and most of these are standardised right across the board. So if you are not happy with your outcome, reach out to your provider and try and have an honest conversation. Talk about how you feel things have happened and how you would have expected them to happen, because sometimes there's an explanation for that. Sometimes the plan has had to be changed intraoperatively for whatever reason based on your body anatomy, and that's usually discussed with the patient and the surgeon at the follow-up appointment. If you're still not happy, you do have the right to raise a formal complaint. Most complaint procedures have standard processes in them, and that is usually that when you send in your complaint, the provider should respond to you within 2 working days to let you know that they've received that complaint and let you know what the policy is and the timeframes for handling that going forward. At Cosmedicare, it's a 21-day policy, so 21 working days, which allows us time to investigate your complaint fully, to speak to the relevant people involved, to collate any paperwork that's involved and formulate a response coming back to you as well. One of the things that I would say, and I think people are unaware of this, there are no monetary recompense for dissatisfaction with surgery, and I think maybe people aren't aware of that before they go into things, but it is written in the terms and conditions, so please read your terms and conditions before agreeing to any surgery with any provider. Dissatisfaction and making formal complaints for expected revisions of aspects that are not covered within a revision policy, they're usually not productive, and we will try our very best, as I'm sure other providers do as well, to meet patients' expectations and have everyone leave with a happy outcome. But I think there also has to be a mutual respect for expectations and what is physically possible under the terms and conditions of the procedure that you've opted for. So we've all heard the phrase botched, particularly in relation to cosmetic surgery. There was a whole TV programme called Botched, and I think it received one of the most highest viewings for that channel that broadcasted it. Botched is a really volatile word to use. Within the industry, the professionals would say something that has been botched is something that is going to be very, very difficult to rectify. Scar tissue, medical malpractice, improper technique used during the surgical procedure, a practitioner or a surgeon doing a procedure that they're not qualified or experienced in doing, and that leads to a botched job. There's a very big difference between a botched job and a patient being unsatisfied with their outcome. So please be mindful that when you're seeing some negative comments online, if I was a person reading that, what I would do is reach out to that person to try and engage an understanding of their experience of what happened, and I would actually ask for before and after pictures. I can say hand on heart openly that we have been in receipt of things like this online, and there's been many a times where I've sat behind my computer screen and wished that I could say to the person who was typing this, who was putting across this experience, please post your before and after pictures, because as I've said before, they're very subjective, and what that person's expectation might be in relation to the outcome, most people would say it's a good outcome, but it's very difficult, as I've said before, for providers to respond to that in an ethical and legal way. So sometimes I think it might be best for the prospective patient to reach out to that person that has made the complaint and ask for the images. When it comes to images as well, those can also be quite misleading, because Medicare don't doctor any images, we don't edit images. What we do is when we're asking for images before surgery, so even when you're making your inquiry, we ask for one straight on and one from each side. And when we're doing our after photographs, we ask for the same format of images, so that the images are reflective of each other from the before and the after. And that's definitely something that I would advise people to look out for as well.